started.
Hi, Teresa Zimney, and I have Laura Keller here with me, who's the Director of Public Health Nursing for Napa County Health and Human Services, and she's an expert on public health home visiting and its impacts on our childhood development and outcomes. So Laura, what is the Fussy Baby Network Approach? How does it work?
So the Fussy Baby Network Approach was a model that was created at the Erickson Institute in Chicago by a couple folks there. And actually, two of the people that created the model were actually fellows of Barry Brazelton. Mm-hmm. So very steeped in the touchpoints approach and Brazelton's work. And so Fussy Baby is a model and approach really for colicky babies. And so that would be babies who have problematic crying, sleeping, or feeding. And it's really mostly about the parent's perception of the problem with crying, mm-hmm. sleeping, or feeding, because the perception of the problem is about the relationship between the parent and the child. And sometimes it's rooted in a physiological problem, like a little immature gut that's having trouble digesting, or it's a relationship problem where there's perhaps a poor fit, or the process of mutually regulating and self-regulating is somehow a little bit derailed. So there can be a lot of complexity to what's actually going on in the family, and that people need someone who has expertise and mm-hmm. trained in that area, who can come and be of support, but kind of help the family understand what processes are happening and how to correct them to make the relationship and the attachment stronger.
So you could have a colicky baby, anyone could have a colicky baby, so then you layer in there the environments that these babies could be living in when you have these other risk factors,
right.
Employment or lack of employment, poverty, mm-hmm. and the other sort of situations that you're seeing in these homes.
Yes, and we all know that parenthood is really stressful anyway. I mean, even, for the person who thinks they're really well prepared, then mm-hmm. they get the newborn and the sleep deprivation and everything that happens. It's very stressful. Right. So parents really need support in as you said, in these more stressful environments with poverty or, job loss or marital stress. It even becomes more critical. Right. So the Fussy Baby model was created for that kind of intervention, and one of the things I really like about it is it actually took the Touchpoints model and made it more explicit in a way in the Fussy Baby model.
So what results are you seeing? Is this an early implementation, or has this been around long enough to start seeing the impact of this model?
Well, there's actually quite a few Fussy Baby sites now all over the nation, hence the Fussy Baby Network, and mm-hmm. they are working towards becoming an evidence-based practice, and they're collecting data right now. But one of the other ways it's being implemented is as an infusion process, so that it's not just about colicky, fussy babies, but it's used as a model of intervention for families. And the Fussy Baby model has a Fussy Baby fan, and it's a beautiful fan, but it's really a way to understand reflective practice, so that if you're the home visitor, you can use that fan to really understand where you are in the process of the home visit and the relationship with the parent or caregiver, and it gives you kind of a roadmap or guide about where you are and where the parent is and how to sort of gauge yourself and what to do next. So it's a reflective practice tool, and it's a beautiful tool. It's a really wonderful tool to use with home visitors.
So in the fan, there's the reflective elements.
Right.
Is there any one particular reflective element that you find more critical than the other, or is it a continuum? You go through it in a particular order, or how does that?
Well, I wouldn't say there's an exact order to mm-hmm. it. There's different components of the fan, and you can move back and forth between them, but it's more about developing self-awareness. And two of the parts are One is mindful self-regulation, so this whole idea again of self-regulation and mutually regulating, which adults do with each other all the time, right? We do it our whole life, so that if you're a home visitor and let's say you go into a really chaotic home, you get there and it's like the TV's blaring and people are screaming and there's a dog in the room, or it's a really unkempt or dirty house, then the home visitor has to learn how to self-regulate and calm themselves down so that they'll be able to be present for the family. So mindful self-regulation is how you get yourself under control, so then you can interact in the relationship. So that's a really important part. And then another one is empathic inquiry, so that you can speak to the parent in such a way and ask meaningful questions and be really curious about their experience. So that takes a little letting go and surrender on the part of the home visit to be present and comfortable and confident enough to let the process unfold and not to have to be jumping in with advice or telling the parent what to do. So I think those two components are really, they sort of precede the other components of the FAN, but they're really important for your development as a home visitor.
I would think it would be really compelling to you see a situation and you just want to, this is what you're supposed to be doing.
Yeah.
So what have you heard from other public health nurses about this approach? Is it something that, given what I've heard, it would be hard to disagree with?
Right.
It all makes sense, and it's emerging or it's evolving into an evidence base. What's your experience or observation in terms of the reaction of public health nurses on this approach?
You know, I feel like it's one of those things that the model sounds fairly simple, but it takes a while to incorporate, and it can be a little painful or uncomfortable for people, because other disciplines are more used to reflective practice. For instance, therapists and counselors, that becomes a part of your work. But especially in infant-parent mental health work, because the work is so intensive and it's about relationship, it's an essential ingredient for being able to do the work and then sustain yourself in the work, because it can be emotionally draining and hard, and so the home visitor needs a kind of scaffolding for themselves, and that reflective practice piece built in is really helpful. I also think with public health nurses, they have a developmental spectrum themselves of going from novice to expert, and when you're a novice, you're much more focused on tasks. You know, you want to get things done and get the paperwork right and figure out how to do the electronic documentation, so that I think sometimes the reflective practice feels a little awkward or maybe a little confronting. But as nurses develop and evolve, I think they grow to really appreciate it and see the beauty of it and how essential it is to their practice. But it takes time, because it's less about doing and it's more about being.
Yeah.
So a lot of us, you know, grow up in systems or we're educated in ways that we're not so comfortable with being. We're really good at doing. So it takes a little shift in awareness to be able to do it.
So the public health nursing practice, again, is something that impacts community. It's community public health. And, you know, what I've heard through the sort of the evolution of the practice and, you know, through touch points and into a practice such as this Fussy Baby Network, it really does, even though you're working with at-risk families and it seems more like a treatment, this isn't an upstream approach in that you're getting at children and families and having impact on the very young before they have a chance to grow up.
Right.
And become part of the
Right.
system that we know we invest a lot of dollars in and
Right.
not very successfully.
Right.
So congratulations to you and your nurses and everything that you do and all this wonderful work. And it's our future.
It is.
The work that you
It's
do.
really important work, and I just thank you for asking me about it. Yeah.
Great.
Thanks.
Thanks.
Cool.
Let me see if I can. Wow.